The Ministry of Health has provided an update on the number of Zika infections in the country. The ministry says there are 581 suspected Zika cases, of which 305 have been tested. Of those tested so far, 177 results have been received and 49 of those have tested positive. Lorna Perez, surveillance officer at the Ministry of Health, gave the most recent update.
Since then, we confirmed Zika. I believe it was around June, July that we confirmed the presence of Zika in Belize. We have been working closely.
A snapshot of where we are at this point. Looking at suspected cases, when we refer to suspected cases, we are looking at persons who present at any health facility with any of the defining characteristics of this condition. The doctors might put a diagnosis, temporary diagnosis. As you might be aware, we have not been screening everybody. So not every person that presents with symptoms are actually screened. They're not really getting a sample taken from them. So some cases will get screened, and since week 34, which is like a month ago, there was a kind of criteria set for persons who are our priority groups, which includes the under 5, children under 5, the pregnant women, and the elderly will be our priority group. As we know, testing everybody really is not feasible at this point.
Perez gave a breakdown on cases tested and the spread of Zika infections when it comes to demographics. The Belize district showed the highest amount of Zika infections, and Corozal has not reported any case as yet.
So when we look at the numbers here, we have 581 suspected cases. Of these, 305 have actually been screened, which means a blood sample or a urine sample has been collected from these persons, which represents 52.5% of all suspected cases being screened. Of these 305 tests that have been done, we have received 177 results, which represents 58% of all samples taken, which means we are still pending some results now. Of these 177, now we have 46 positive cases, which is 26%. So far we have that as our positivity rate. So far we will wait until we get all the results. If we look at the districts most affected, Belize district, of course, if you look at raw numbers, then Belize district has 262 suspected cases with 21 actually positive cases. But if we look at the rates, which really looks at the proportion of persons infected per the population in that community, you'll find that Toledo actually has so they have 2 infections per every 10,000 population, which is the highest rate in the country. But in regards to numbers, as I said, Belize is next, followed by Cayo, as the districts of where we are having most of these cases. If you notice, Corozal is the only district that has not reported any positive case so far.
Dr. Marvin Manzanero, Director of Health Services, spoke about the efforts of the ministry has made to mitigate the spread of Zika and stated that containing the vector disease needs to be a community effort.
The effort here has to be a collective one, in that we need to be at the forefront. I think we have recognized that perhaps we need to find more dynamic ways or more innovative ways of trying to get the message across to the general population. It's unfortunate then that people are concerned about Zika only when you talk about a crisis situation, when you want to link it to microcephaly, when you want to talk about Guillain-Barré. But the general norm is that people are not seemingly overtly concerned with Zika. So I think it's an ongoing educational process of trying to ensure that everybody is on board and everybody is aware of the potential implications. As Mr. Bautista had mentioned, this is really a community effort more than just a Ministry of Health effort, and Zika is here to stay. I mean, this is a current wave. Next year, whenever the rainy season comes again, it's gonna come again.
The ministry is asking the public to help in the prevention of Zika by maintaining a healthy environment free of mosquito breeding sites. Kim Bautista, Chief of